Obamacare is collapsing. Republicans have a plan to repeal and replace it. At least that's what it says on the GOP website for introducing the American Healthcare Act. We're going to go ahead and break down what this actually means for everybody. And I'll give you my take on it, my personal take on this. So, first of all, does it have a requirement to pay a penalty at the end of the year, just like the ACA does? No, it does not. So for some people, initially, that would be actually a good thing. But actually, that they're implementing a penalty in a sort of a different way. So if you don't have coverage for over 63 days, then they will impose a penalty on you. I believe the penalty is about a 30% higher premiums. Yeah, that's correct. It's a 30% higher premiums for 1 year. So that the whole idea of you just removing that penalty, the end of the year penalty, just because they don't have health care, and then you just re-implement it in another way to where it incentivizes people to have that coverage just in the first place. It's just bullshit. Um, but there's some more problems with that particular aspect of it, and we'll get to that a little bit later on. So, what about some of the other things that are carrying over from the ACA? So, insurers can't deny coverage to anyone based on their health status. So, for example, pre-existing conditions, they are carrying that over that they cannot discriminate against people who have pre-existing conditions already. So, so that's actually a good thing as well. For any children who are already on their parents' health care plan up to about 26 years old, they will still carry that over from the ACA. So that's also a good thing. But let's talk about a little bit of something else. So Medicaid. So Medicaid under the ACA was expanded to people at about roughly 16,000 or up to about roughly 17,000 per year. It was expanded to cover a little bit more people. And after 2020, the Medicaid expansion it will be going away under the GOP plan. Now, if anybody remembers on the campaign trail, what Donald Trump was constantly talking about was that he would not allow anybody to touch Medicaid. I mean, does anybody remember that? Because I sure do. And I think that's a little bit dishonest that actually uh, that he's done a complete 180 in this particular situation, or he's sort of like he. I wonder how he's going to actually even answer for that. Now, let's talk about whether or not insurance is going to cover certain benefits. Now, for the most part, a lot of that stuff from the ACA is also going to actually still convert over. So, like prescription drugs, mental health care, uh, maternity coverage, they're going to also cover that as well. Now, let's talk about the cost of these plans. So, um, the cost would actually run about for younger people that you have about you have a $2,000 tax credit cutoff actually per year for younger people. And while they've increased the income brackets for people who can access it to those earning under 75,000 or 150,000 for a married couple who would qualify for this. Starting at 2,000 a year for those under the age of 30 and increasing in 500 increment per decade in age up to 4,000 a year for those 60 and older. So the tax credits are a little bit more lucrative for people who are a little bit older. And the tax credits now are actually, instead of based on income, which the ACA is now based on, I think the cutoff is actually roughly about 48,000 for you to qualify for a single person, and it does vary depending upon the size of your household as to whether or not you qualify for that well, not even a tax credit. It would actually be a subsidy, but this, in part, at least as far as the Republicans are concerned, is a sort of a means. When I'm talking about the $2,000 tax credit, they're pitching this as a way to incentivize younger people to purchase a healthcare plan on the private market. So that they're also talking about for some of the older people around roughly 60 years old that their healthcare coverage usually costs more, so they get a little bit of a higher tax credit because of that. But there's also a double-edged sword that comes with that as well, where they state that actually those people around that age range can get charged up to 5 times more. So even if they get $4,000 more in tax credits, they are actually getting charged significantly more than the younger people. Um, so my problem with that situation is that while it may be true that healthcare coverage is actually a little bit more expensive for the older people, it is really insane for people to think that charging older people 5 times as much in premiums is okay and $4,000 in tax credits is going to cover that. Because even if even with the even with the tax credits are taken consideration are concerned, um, let's say the opposite is the case, where of course as an older person you're getting charged more, you're getting charged 5 times more. But what if their income is actually closer to that of maybe $16,000 a year or $17,000 or $18,000 a year, but you're going to charge these people 5 times as much in premiums, and the younger people are getting charged less, but they're getting less tax credits as well. But what if they get paid more? I mean, this situation doesn't take into consideration anybody's financial circumstances, really. Age alone doesn't necessarily tell you much of anything about a person's financial circumstances. Now, while your income alone doesn't necessarily tell you nothing about your circumstances, or doesn't tell you much of anything about their circumstances, at least it's a more better criteria to sort of base it on. At least it's more personable to you. Age doesn't really tell you much of anything because you can be living in poverty and be in the 60s. So this is not actually a good plan at all. In fact, it actually raises the barrier because after 63 days, if you don't necessarily have if you don't have coverage at all, then they're going to charge you 30% higher premium. So imagine that if you were an older person and you were getting charged 30% more, on top of that, you're getting charged 5 times as much as a younger person would. That is crazy. That is fucking crazy. So this whole idea that Paul Ryan was talking about, this is an opportunity to give people more choices. Yeah, and he's right. It's an opportunity to give people more choices to get fucked over even more. He's making this a concession with these private healthcare entities to allow them to make more money and to cover less people, but make the more money. And for some people who don't necessarily understand how insurance actually works, the more people you have to cover, or the more regulations that you have to deal with, the more likely it is for you to not make less money. So one of the ways that a lot of insurance companies make a lot of money is to deny coverage or to offer cheaper options. If you're not a lucrative customer to them, then why would they have you on? All they've done in this particular case is they've raised the bar to where now they're getting more money. And not only that, but there's a provision in the bill that allows for healthcare CEOs who make over $500,000 a year to now get tax credits. So all he's really done is that now he's just incentivized these companies by giving them, if the CEOs are not already making $500,000 a year, then they've incentivized them to now become profitable to the point where now they're gonna want to pay the CEO over $500,000 a year, or they're already going to give tax credits to those people who are already making $500,000 a year. So all you're doing is you're just fucking over the people. You can give tax credits to CEOs of over $500,000 or who are making that much, but you can't come up with a better plan that is more affordable. This doesn't give you more options. What more options do you get because of this? When you say options, do you mean more options for the companies to fuck you over? Is that what you mean, Paul Ryan? Because that's pretty much what this is.
We're going to allow the market to do that. We're going to let people decide what they want to do with their lives, and we want to lower costs by having more competition and equalizing the tax treatment of healthcare, having health savings accounts. That gives people the freedom to buy the plan they want and can afford.
They have more access. Sure, yeah, they give you access, all right. They give you access to situations to where like you are not going to get health care at all. The ACA wasn't all that great especially when you take into consideration, like the cutoff for some people around 48,000. If you were a single man, you would get cut off at about roughly 48,000. But at the same time, though, that the the replacement, or this so-called replacement, doesn't really it offers people healthcare coverage over 48,000 as well, but it raises the bracket in such a way to where, like, now only people who have very lucrative income can only get this healthcare. Part of also was a part of the bill was any entities that provides abortion services will no longer receive federal funding. So that includes Planned Parenthood, of course. Now, that Planned Parenthood has been a large circle of controversy that's been going on for a long time. I mean, me personally, I have no problem with Planned Parenthood. I'm actually pro-choice. But Trump and several Republicans have been claiming for so long that they don't want federal funds to be used on abortion services. But it's actually illegal to do that. It's illegal to use federal funds for abortion services. That's never been the case with Planned Parenthood. This is just a way to destroy Planned Parenthood, because as a part of the bill, since Planned Parenthood offers those services and the people have to pay out of pocket for that, this is their way of shutting it down, by saying, yo, yeah, you don't receive federal funds, but we're going to tell people that you receive federal funds to pay for abortions. And if you're not going to do what we say, then we're going to go ahead and shut you down. But the thing is that roughly 3% of the services that Planned Parenthood offers is actually directly to abortions. They offer thousands of services to people, amongst like pregnancy tests, sexual education, birth control, which is not abortions. Let's make that clear. But it's just really sad that this is their option. This is something that they're proposing to people out there, and I hope that this doesn't actually pass. But in my opinion, this is really dead on arrival. That this idea that they're pitching out to people about, this is choice. It's not choice. But let's go over there to a clip actually of Donald Trump saying that he wouldn't necessarily do anything about Medicare or Medicaid.
Every Republican wants to do a big number on Social Security. They want to do it on Medicare. They want to do it on Medicaid. And we can't do that. And it's not fair to the people that have been paying in for years, and now all of a sudden they want to be cut.
So, Donald Trump, what do you have to say about you going after Medicaid, the Medicaid expansion? Are you going to address the fact that now that you've lied to the American people? I mean, you're destroying the Medicaid the Medicaid expansion. So are you going to answer to that? But I highly doubt that he's going to do that.